Hey guys, so we're going to do things a little bit different since we're not in class. I'm going to do a few really short online lectures for you for your cardiology specifically because this is one of the classes that if we don't stay on schedule, we have so much to cover, we're going to fall behind. So today we're going to look at first degree and second degree AV blocks. And then in a separate video, we will look at third degree AV blocks. So first degree AV block, we actually talked about a little bit a couple of weeks ago. To start with, let's review this. So, intrinsic firing rates. That's important, especially when we get to later discussions. So, SA node, the intrinsic firing rate is between 60 and 100 beats per minute. And that's why if you take the heart out of a man's chest and put it on the floor, it will beat at 100 times a minute. The AV node, I'm just kidding. The AV node beats between what? What's its intrinsic firing rate? Oh yeah, it's 40 to 60 beats per minute. The Purkinje network, or ventricles in this case, beat between 20 and 40 times per minute on their own. That's what the intrinsic firing rate means, on its own, without any external factors, any external stimulus. Excuse me. So, first degree AV block is fairly simple. First degree AV block occurs when there is a prolonged delay at the AV node. So we know the AV node's job, one of its many jobs, is to hold the energy for a moment to allow time for the ventricles to fill with blood. If it holds that energy for a little bit too long, what part of the EKG is going to be altered? That's right, the PR interval. So we would have a PR interval that looks like this. P wave, long PR interval, QRS complex. That PR interval is going to be greater than what's normal? 200, right? Less than 200. So it's going to be greater than 200 milliseconds. PRI greater than 200 milliseconds is a first degree AV block. Now, did this affect how the ventricles depolarize? Once the energy gets into the ventricles, did it change anything in there at all? No, it did not. So my complex should not be changed. It should still be a narrow complex. If it's a sinus rhythm, it should be a narrow complex. Should still have a regular R to R interval. All the other things are going to match up. It's going to be a sinus rhythm, more than likely. But I'm going to have a prolonged PR interval. That is a first degree AV block. Simple enough. Moving on, second degree AV blocks. There are two types of second degree AV blocks. There's a type 1 and a type 2. So at least they make that part easy. We can call these a second degree AV block, or we can also call these a second degree Mobitz, M-O-B-I-T-Z block, and we'll call this a Mobitz type 1 and a Mobitz type 2.
Mobitz type 1 and Mobitz type 2.
Second degree Mobitz type 1 is also referred to as a winky Bach. You may have heard that term before. You've heard the little rhyme, longer drop must be winky Bach. So what that's talking about is the PR interval. So with a type 1, Mobitz type 1, the PR interval with each complex gets a little bit longer than the PR interval for the last complex. I know my complexes are getting wider too, but that's not part of this. Until eventually, you've got a P wave and then no complex. So we're looking at the PR interval from here to here, from here to here, from here to here. And you should be able to see that this PR interval is getting longer with each complex that we come to, until eventually we have a P wave, but we have no QRS complex. We've dropped the complex. That's what we're talking about when we say longer drop. The BR interval, excuse me, BR interval gets longer with each depolarization until eventually we drop a QRS complex. Now, with heart blocks, it's not normally the block itself that causes big problems. It is the ventricular rate that causes problems. If you think back, talking about PVCs, whether they're perfusing or not, if we had non-perfusing PVCs and say it happened every third or fourth beat, that drastically decreases our underlying rate. And so the same principle applies in heart blocks. When we start getting bradycardic, that's when we're going to become symptomatic, hypotensive, dizzy, chest palpitations, so on and so forth. We're going to have to do type 2 in a separate video because I can only record 6 minutes at a time.